Well, metropolitan Detroit's peak in this coronavirus pandemic is expected to hit over the next week, according to the White House. To see what life is like on the front lines in the Motor City and the suburbs there, I want to bring in Dr. Sanford Vieder. He's Beaumont Hospital Emergency and Trauma Center Chairman. Dr. Vieder, welcome. Good to have you with us. What kind of caseload are you seeing? How are you handling it?
Well, we're handling it pretty well. We're doing certainly the best we can. Everybody's working long hours, and we're certainly worried about our workforce, and it's a marathon. We've been seeing high numbers of very ill patients over the last 7 days or so, and still anticipating, based on predictive models, that we won't hit our peak until another few days later this week. But so far, we're holding up okay, and I really want to just, especially make a mention of, it's important that we share the victories, because we do have a lot of patients that are recovering. We have patients that are coming off ventilators, and we're seeing a lot of discharges home of people who are recovering. So I know there's a lot of focus right now on all of the deaths, which of course are extremely tragic, but there are a lot of victories, and fortunately more victories than we have losses.
And people do get well. I hear that one of the things you have put to use and to great success is kind of drive-up testing at some of your locations, where you have sort of one staff that is in charge of taking people's vital signs and seeing how sick they are, and those folks are separate from the people who are working in the hospital proper. Tell us about that. Yes. And how and why that seems to work.
Yeah, well, so we started doing that throughout the entire Beaumont Health system, and each of our hospital emergency departments, all 8 of them, have been doing this curbside screening now for almost 2 weeks. What that allows us to do is offload mildly symptomatic patients, or even the worried well, so that they're not entering the emergency department proper. That gives us an opportunity to decompress the interior of the emergency department, so that the activities in the emergency department are really focused on those who need it the most. What we're typically doing is that patients who come up are initially screened to determine if they are in need of acute emergency intervention. If they're not, then they're rerouted to a curbside screening where vitals are obtained, and a physician actually does an examination of the patient in their car. Right. So that's something that we've never done before. Certainly very different than where we were practicing a month ago, but it allows us to really determine if somebody can safely go home and quarantine at home versus needing to come into the emergency department. We'll check their vitals, their temperature, whether they're oxygen saturating properly or not, and make that determination.
Quick question and quick answer, if I might. Do you have the protective equipment, the beds, the ventilators you need now, and do you anticipate that you will have the number you will need as the peak comes, maybe later this week or next?
Well, right now we're doing okay. We do have plenty of PPE equipment, and our supply chain has been fortunate enough to be able to obtain what we need, but we're certainly concerned about it. We don't know what the future holds. Nobody has a crystal ball, and the predictive models are showing that our peak is still yet to come. So that certainly is a concern. And with the pressures on the global supply chain being what they are, that is certainly in the back of our minds. One of the things that Beaumont Health has done uniquely is that they developed the process to be able to sterilize our N95 masks. So that's something that we're doing to try and spare PPE, but we certainly have enough at this immediate time. And we're also fortunate to be in the Detroit area, where there's, the prowess of local manufacturers, the automotive companies, who have gotten into the game and have helped out in terms of developing different types of PPE and distributing those.
Dr. Vieder, thank you very much. Thank you for your very good work. Keep doing what you're doing. God bless you.